Welcome to Session 0, Understanding Dementia. My name is Jane Marks. I'm a nurse in the Division of Geriatric Medicine at Johns Hopkins and part of the Geriatrics Workforce Enhancement Program. I'd like to also acknowledge other contributors to this program: Eileen Rosenthal from the Alzheimer's Association of Central Maryland, Diane Martin, the University of Maryland G. Geer, and Kim Burton, a consultant in mental health. We're going to talk about dementia, and it's important to understand that dementia is not a normal part of aging. It is a general or umbrella term that describes a group of symptoms characterized by a decline in cognition, including memory, language, problem solving, and other thinking skills that affect a person's ability to perform activities of daily living, and eventually the ability to carry out instrumental activities of daily living. Changes may also affect behavior, feelings, and relationships. For example, someone who is usually very calm and soft-spoken may react with anger. Activities of daily living, or ADLs, are things that we do every day in our self-care. This includes things like bathing, dressing, eating, grooming ourselves so we look good, toileting, and moving around, mobility. Instrumental activities of daily living, or IADLs, they require greater executive function, more thinking and processing. So examples of this include things like managing your finances, balancing your checkbook, handling transportation, navigating your way around, being able to shop for things that you need, like groceries, using the telephone, getting your meals ready and preparing those, as well as keeping your house up, doing the housework. You can see the difference that IADLs require higher level of function and ability to process that information. It's important to remember as we age that not everyone ages the same. One 80-year-old is not the same as another 80-year-old, and there are many factors that come into play with that. Some factors that may affect older adults to carry out ADLs and IADLs may be chronic medical conditions, such as arthritis. They may experience some vision difficulties, as you see here on the screen, where their vision may be cloudy from cataracts. And many may experience difficulty in high-pitched sounds. Dementia is caused by damage to brain cells. It interferes with the ability of brain cells to communicate normally. The brain consists of many nerve cells that carry messages and communicate with other cells. Different types of dementia are associated with particular types of brain cell damage. It's important to know that cognitive decline or changes can also be impacted or caused by medical and psychological conditions. It's important to consider this when a change is noted. Some medical conditions that can impact cognitive function include vitamin deficiency, hypothyroidism, delirium, or when someone becomes acutely confused, medications, including side effects or even drug-drug interactions. Psychological conditions include things like depression and stress. So let's think a minute. Let's brainstorm. What could you do if you suspected someone having some cognitive decline or changes? So, for example, you saw your 94-year-old neighbor looking unkept, not her usual self, and outside at midnight wandering the neighborhood. Take a minute and think, what are some actions you could take? Well, if you didn't think, some of the things that you might want to do is talk to the person. Ask her or him, have they been feeling well? Have they been under the weather? Perhaps they've been ill. Maybe encourage them to make a doctor's appointment. You may need to offer to help them get there. And if they have family or a close friend, reaching out to them to make sure maybe that they know there's been some changes. Maybe they aren't aware of it and they can also help. It's vital that a person's primary care provider be aware of any changes. That way they can help determine the cause of cognitive decline and decide if it is related to a medical or psychological condition, or is it perhaps a decline in their cognition and possible dementia. The diagnosis of dementia, there's not really one test to diagnose dementia. It's made primarily by the primary care provider, such as a general doctor that they may see, or if they see a geriatrician, someone who cares for older adults. Sometimes the provider may refer them to a specialist that deals specifically with memory, such as a geriatrician or a psychiatrist, or even a neurologist. Diagnosis is based on careful medical history, and that includes psychiatric history as well as physical and neurological exam, laboratory test, and information from family or caregiver. And that includes cognitive and behavioral changes that they've observed. Sometimes providers may diagnose dementia, but not able to specify the type of dementia because symptoms and brain changes of different dementias may overlap. Most forms of dementia come on slowly and may be preceded by mild cognitive impairment, or MCI. This represents a condition in between normal aging and dementia in which persons have notable problems with memory or other core brain functions, but these impairments are not sufficient to interfere with daily living. The person affected and family members may notice the cognitive changes. Approximately 15 to 20% of people aged 65 and older have MCI. People living with MCI are more likely to develop Alzheimer's disease or other dementias than someone without MCI. However, MCI doesn't always lead to Alzheimer's disease. It's important, again, to have a medical evaluation and follow-up to evaluate those changes in symptoms. Today, we're going to discuss some common causes of dementia. And there are many forms of dementia. I will refer you to the Alzheimer's website for more details of various dementias. Alzheimer's disease is the most common cause of dementia. As you see, it accounts for 60 to 80%. It is not a normal part of aging. However, the risk factor is that as your age increases, your risk factor increases. The exact cause of Alzheimer's disease is not yet known, but there are high levels of certain proteins that do make it hard for brain cells to stay healthy. And it leads to nerve cell death and tissue loss throughout the brain, causing a slow decline in memory, thinking, and reasoning skills. And today, there are noted about 6 million Americans affected with Alzheimer's disease. So what are some risk factors associated with Alzheimer's disease? Well, as I noted, they include advancing age. Certainly someone who's physically inactive may have a high cholesterol, may be related to poor diet, high blood pressure, smoking, and obesity. On an average, a person lives 4 to 8 years after a diagnosis of Alzheimer's disease, but could live as long as 20 years, and again, depending on the individual. So let's brainstorm again. Considering the risk factors we just talked about, what are some possible lifestyle changes that you could make to lower your risk of developing Alzheimer's disease? So take a few minutes here and think, what are some things that you could do? Well, how about regular exercise? Maybe healthy eating, having that colorful food plate. Watch your weight. Don't smoke. If you do smoke, try to cut down and quit. Avoid excessive alcohol intake. Keep up with social activity and, with your friends and connections. Keep your blood pressure and your glucose in control. And stimulate your brain with activities. Current research suggests that healthy aging may help with brain health and reducing the risk of Alzheimer's disease. You can refer again to the Alzheimer's website for the 10 warning signs of Alzheimer's disease with more detail. But let's just read through them. The first 5 include memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks that you're used to doing, perhaps confusion with time or place, and then trouble understanding visual images and spatial relationships, perhaps not being able to follow directions and finding your way back home, or not understanding changes in depth, like a curve. New problems with words and speaking or writing, misplacing things and losing the ability to retrace your steps in finding those things, decreased or poor judgment, perhaps not in being as involved in social activities or withdrawal from work, and then changes in mood and personality. Again, I would refer you to the Alzheimer's website that reviews these in more detail. Alzheimer's disease typically progresses slowly in 3 general stages: early or mild, middle or moderate, and lastly, late or severe. Symptoms worsen over time, and the rate of progression varies with each person. On an average, a person lives 4 to 8 years after diagnosis, but as I mentioned earlier, may live as long as 20 years. Again, it's individualized. In early stage, a person may still function independently, but those close to them notice memory changes. Middle stage is our longest stage, and as it progresses, the person is going to need more assistance with care or more cueing. Also, symptoms may include an increase in confusion, wandering, personality, and behavior changes. The person may not be able to identify an appropriate object. For example, you may ask them to brush their hair and they pick up a toothbrush. In the late stage or the severe stage, the person loses the ability to respond to the environment, maybe perhaps difficulty carrying out a conversation, and really, as things progress, require total daily care. Again, remember, every person is different and their progression through these stages vary and may even overlap. Again, the Alzheimer's website provides more detail of these stages. Well, Alzheimer's disease has no cure, but treatments for symptoms are available, which may temporarily slow the dementia symptoms. Research is ongoing and many clinical trials in hopes of finding a cure. Early diagnosis is important. It'll help lessen the person's anxiety about what they are feeling, and you as the caregiver as well. Families have the ability then to maximize their time together, time to access support, education, and resources. And most important, early diagnosis will help with planning the future and allow the person to make their wishes known. Next, we're going to talk about vascular dementia. It is the second most common cause of dementia, Approximately 5 to 10% of cases are vascular dementia, and it usually results from a blockage or reduction of blood flow or microscopic bleeding in the brain. This usually results from a stroke or series of stroke that deprive brain cells of oxygen and nutrients. The impact on thinking varies depending on the severity of the blood vessel damage and the part of the brain it affects. Next, I'm just going to mention two other types of dementia: Lewy body dementia and frontal temporal dementia. Lewy body dementia is estimated to be the third cause of dementia, and Lewy bodies are abnormal clumps of protein in the brain. Lewy bodies are found in other brain disorders, such as Alzheimer's disease and Parkinson's disease dementia. Many people with Parkinson's eventually develop problems with thinking and reasoning, and many people with Lewy body dementia experience movement symptoms, such as shuffling walk and trouble initiating movement. This overlap suggests a possible link to the same underlying abnormalities in how the brain processes protein. Again, there is a chart in the Alzheimer's website that goes over key differences between Lewy body dementia and Alzheimer's disease. Frontal temporal dementia or degeneration generally has a rapid progression associated with damage to the brain in the frontal lobes. That's the area behind the forehead, and the temporal lobes, the area behind the ear. These areas are responsible for behavior, emotion, language, and a deterioration of these functions are seen. It usually strikes people at a younger age, but usually younger than 60, but can occur in people 65 and older, and is considered a rare cause of dementia. Frontal temporal degenerations are inherited in about a third of all cases, and often misdiagnosed or difficult to diagnose, usually requires an expert, such as a neurologist or physician who specializes. Again, there are many other types of dementia, and as I note, please refer to the Alzheimer's website. Well, let's talk a little bit about care tips. In providing care to a person with dementia, remember that routine is their friend. Try to keep their daily routine schedule with their activities of daily living, such as meals, dressing and bathing, and other activities, incorporating their past habits to make it more personal. So, for example, if they were used to bathing in the evening, then perhaps keep that routine. Remember that you want to involve them in things, in activities, but don't overwhelm them. So, for example, encourage them to pick out their outfit for the day, but maybe have 2 or 3 outfits to pick from, not their whole closet. Encourage them to have some rest periods in between activities, not naps, but just little rest periods so that they don't tire. And remember, looking at activities that may be stimulating, but not frustrating, so that they don't get aggravated. And as the caregiver, you play an important role. The person that you're caring for often responds based on your voice tone, as well as your response or reaction to them. So maintaining a calm, reassuring voice and response to their behavior is so important. A serious consequence of dementia involves behaviors and some other psychological symptoms. Some examples of these include that they may think of family members taking their possessions, or they become insistent on going home when they are home and you can't convince them. They may become tearful and you can't console them. These behaviors may become particularly concerning and distressful to families and caregivers. It's important to establish a partnership with your primary care provider and their team. The Alzheimer's Association and other community resources may be helpful. We'd like to share with you information about resources available to you as well as your care recipient. The Maryland Access Point is a program to offer you connections to services that the person you are caring for may be eligible. There are local connections for each county and city. Maryland 211 is staffed 24 hours to help with resources. Certainly, your local AARP has resources in regards to caregiving. The yellow book that you see is the National Caregiving Foundation. This toolkit is free, and you can simply call them and they will mail it to you. Their number is 1-800-930-1357. Again, 1-800-930-1357. We offer, through the Living Well Center of Excellence, caregiver programs depending on your area. And these include powerful tools for caregivers, building better caregivers, and savvy. I would encourage you, if your care recipient is a veteran, that you reach out to the VA to find out if they are eligible for services. Other helpful organizations include the Alzheimer's Association and the Mental Health Association of Maryland. The Mental Health Association of Maryland provides a guidebook for older Marylanders, and you can simply call them at the number listed here and they will mail it to you, or you can visit their website and obtain the information there. It has a lot of great resource material. And the Alzheimer's Association provides much support and information, as I have spoken about throughout this program, and would encourage you to reach out to them to find out what programs are offered. But again, the hotline 24/7 is available at 1-800-272-3900. And I'd like to offer you my email address in case you have any questions. Again, jmarks@jhmi.edu. And these are some of the references that we obtained this material from today. Thank you so much.